Nigeria is one of the poorest countries in the world. They have limited resources, but they survive by their faith in God.
I am Father Chucks Okochi, originally from Nigeria, now residing here in New York. My assignment is with Calvary Hospital in the Bronx. So working in healthcare, is one of the things that kind of helped propel me to think of, helping those in Nigeria, at least to get a good, better healthcare that they need. Uplift Health International Incorporated, we conduct adult clinic at Ishiagu. We also conduct in pediatric cases, at Ikwo, two separate locations, almost 50 miles apart from each other, but within the same state. Dr. Marcel takes care of organizing and making sure everything is in place for the adult clinic. The adult clinic majorly is one of the driving force behind why this organization, decided to take this mission to track high blood pressure, which is a silent killer, and also diabetes.
We had a large crowd. We have seen over 1,000 patients within the last 3 days, and of 3 days have been made possible by a number of doctors we have here. These are local doctors who work in our community. They are very, very dedicated. They have no problem of translation.
I'm a native of this town. I'm a physician and I practice in the U.S. state of Texas. We are here for the annual Uplift Health International mission, essentially for health screening in this population. A lot of times you see patients with extremely high blood pressure that really, if you see those back in the States, you will want to send them to the hospital right away. But here, they're just walking around as if nothing is happening, but they're actually sick, just that they don't know it. So we are trying to create that awareness and make them realize that there is hope. As long as they are willing to work with us, that there is hope for them to get well.
We were told in church that there would be a medical mission here. I've been having difficulties with my waist due to famine, which is a major problem around here. So I came to see if I can get medication for my pains around my waist and my body.
I'm a pharmacist, and I'm in charge of the medicine management in this program. So my goal is to ensure the appropriate use of the medicines prescribed here and to ensure that there are no wastages. So I standardize the prescriptions and make sure that they are prescribed in such a way that the patients understand the directions properly without much difficulties.
The patients that come to the clinic are not only suffering from diseases, but need treatment for serious injuries as well.
He sustained a fracture of the right leg following road traffic accident. But the problem is that he's just managing it himself at home, which is not the proper way to treat such injuries. So right now, he needs to go to the hospital, have an X-ray, then they'll look at the nature of the fracture and know the proper treatment.
Our goal is always to interact with as many Nigerian physicians as much as possible. For the first time this year, we do have many more physicians who are either from this village or who are close friends of the ones from this village. So we are hoping that we will have those guys be there for the village when we are not there. And that's the ultimate goal for this outreach.
I've worked with American physicians, seeing Western doctors firsthand, communicating with them, been praying for this kind of opportunity to try and help out people. that's what this outreach has brought. And trust me, I just jumped to it, and it's been a very great experience. I'm so happy.
I'm interested for the health of my people. If I see they smile, I feel satisfied.
There's no social welfare, there's no Medicaid. A lot of them do not have money to buy their medication. This is the only opportunity they have. They don't have anybody else to take care of them. Whatever they get from us, that's all they get. And hopefully, as time goes on, we would have curtailed some of this process. And we'll have a hospital that is functional, and they will be going there to be taken care of.
The pediatric case, we have Sister Karen, who leads the team from Johns Hopkins. Last year we did 121 cases, and I'm sure this year we're gonna do even more cases.
I am Dr. Sister Karen Schneider. I am a Sister of Mercy from the Americas, and also a pediatrician with a specialty in pediatric emergency medicine. Right now, I have been employed at Johns Hopkins Hospital in Baltimore, and we partnered with Uplift International. I'm always looking for a place to be able to take young doctors in training and give them an experience where they can actually see poverty medicine, see medicine in a developing country, and have an experience where they can actually feel, really for the first time, where they've got a bit of training and they can actually help people.
Sister Karen Schneider came to my high school and she spoke at one of our assemblies. When she came, her story talking about the mission that she's involved in was very inspiring, and I am so honored to be serving alongside her on one of her trips.
One of the goals of Uplift is to bring American medicine and American doctors to Nigeria, to work with the doctors here and the medical professionals, to train them. They're eager to be trained. They want to be capable of caring for their own people. So we want to help them to do that.
We are able to offer the people here pediatric hernia surgeries and pediatric undescended testicular surgeries. Right now, we're working in facilities that do not have electricity and don't have running water. Many of these folks are not able to afford the surgery. So we are seeing many, many, many children here who have unrepaired hernias.
Hernia surgeries are done by skilled American doctors. There have been no complications in all the years the mission has traveled overseas, and all patients are released in less than 24 hours. The American doctors come prepared to work in poor conditions while still providing first-class sanitary pediatric surgeries.
After the surgeries are done, one of our challenges are how do we provide quality instrumentation and providing them with the maximum cleaning protection that we can. And at night, one of the team members will go to a place that we have found that have electricity, because without electricity, we can't sterilize the instruments. And they will spend approximately 3 hours bagging them in clean bags. Every instrument, we have maximized the cleaning capacity to continue providing quality care for every kid.
So this gentleman had a more invasive surgery than our usual kiddos. And so because of that, the surgeon wanted to give him a dose of antibiotics just to make sure that he had more prophylaxis to prevent infection.
So this little guy's had about 3 days of fever, and he's got some wheezes and diminished breath sounds on the left side, so we think he's probably got a pneumonia. And we're just doing some chest PT to try to get the secretions up out of his lungs.
I was very moved by a young family I met when the 20-year-old mother brought her 3-year-old boy for surgery and had to bring along her 3-month-old who was nursing, couldn't leave her at home by herself. She traveled to have the surgery, 30 minutes on the back of a motorbike, she and the 2 children, to get to the clinic. She was really frightened and afraid. She was extremely poor, and she was very willing to share what her life is like with us. She showed us where she and the children sleep, on the soil on a ground floor, with a mosquito net over them, she and the 2 children. They cook in the back of the house in a yard with just a couple of pots and pans. She told us that her diet consists only of rice and potatoes. They gather water when it rains, or if there is a puddle that they're able to scoop out some water. And when I asked her if she ever ate meat, occasionally, because it's cheap, they can get donkey meat. So this mother told me that she and her children are starving.
The problem is that one of the testicles was not good, and somebody informed me about the coming of the medical mission. Before, there was no hope around that I would get help, but I knew that there was hope that God would provide for me.
When I asked her what her hopes were for her children, what she wanted her children's lives to be like, she said to me that she wanted them to have food and she wanted them not to be sick. That's all. And I thought about parents in the U.S. and what dreams and aspirations they have for their children. Make a good sports team, get a college scholarship, go to an Ivy League school. And this woman, all she wanted was food and not to be sick for her children. That's just surviving.
Sister Karen has been a blessing, to the people of Ishiagu and to our organization. She's so devoted in organizing this team, and it's been a wonderful, mission working with her and with the team.
In hopes of being able to open up this new clinic is that people would maybe see it as a center of excellence and a place that is affordable. And even if they're poor, they'll be able to bring their child there, maybe when there are free campaigns for surgeries. But we can hopefully monitor and offer surgeries, better surgeries, U.S. standard surgeries, and affordable surgeries in the new clinic.
Now the hospital is completed, but we still need medical equipment to be able to get it functional. So it's just a structure, standing, but we don't really have the medical equipment we need right now to be able to get the hospital up and running. The property has also been secured because we built a wall around the property with a gate, and we have security guards that keep watch 24/7 on the property. The access route to the hospital itself is just horrible. A lot of work has to be done to get an access road from the residents of all the citizens within Ishiagu to have access to the hospital, and we're working on that. One other thing that Uplift Help International Incorporated has done is to have the indigenous nuns at Abakaliki Diocese, run the clinic. And we have established a partnership with them, so that they will assign, medical professionals, like nurses, social workers, and an administrator to run the hospital.
I belong to Sisters of Jesus, the Good Shepherd congregation. We are the only indigenous congregation here in Abakaliki. We have a school of nursing here where we attend. We have many sisters who are nurses and doctors. Anytime we come for follow-up screening, we start with prayer. After that, we advise them, letting them knowing that it's only God that heals. We are giving them medication just to help them physically, but spiritually and otherwise, it's God.
Last year, we began a project, building a convent for the nuns who will be running this hospital on a daily basis. That convent was initiated or began in August and is completed as we speak. Again, the nuns will be living there and be running the program on a daily basis within the hospital. The demand is so much that we still need a lot of support from our donors and getting more people involved in volunteering. The whole essence of the mission is everything is totally free. Surgeries are free, medications are given free. So people are now thinking, how can they help? Which is one of the essence of what Uplift is trying to do, to let people know that we need to help each other as much as we can.
I greatly admire the doctors and the volunteers who come here on this medical mission. They often take vacation time. They leave their comfortable home and their families. They pay their own expenses. It takes 2 days to travel here, 2 days home, but they're willing to do it because they know that there's a greater purpose to what they do. One contribution that I feel I've made on this trip is the development of relationships with the families, with the parents and with the children. I've tried to work with them, to comfort them, to make them laugh.
I always look forward to this mission every year. It's a lot of tension, a lot of preparations, but at the end of it all, when the mission is over, you can just see the joy on the people who have received the medical attention that they needed. And that's a blessing. It just uplifts.
We're here not just to provide medical care, but we're here to let them know that they are loved and they are cared for, and to know that we're all God's children. And that's why we're here, for a greater purpose, so that their lives can be better.
Baby coming. No hernia left behind.
The American doctors are experts. They are perfect. They are perfect. I'm so happy. I'm so glad